Well, ladies and gentlemen, it's time for our next session, Governance for Heat and Cooling. This discussion will highlight the importance of cross-sectoral partnerships between government departments and key stakeholders to drive sustainable action. We will also explore the pivotal role of local governments in implementing heat and cooling measures and how they can be empowered with resources, technical support, and policy guidance. It's time that I invite forward on stage Mr. Abhyant Tiwari, Lead Health and Climate Resilience, NRDC India, to set the stage for this session. His interest includes environmental, climate, and disaster risk to public health, and he works to advance evidence based adaptation and mitigation policies and actions in these areas. Ladies and gentlemen, put your hands together as we welcome Mr. Abhyant Tiwari.
Very less left now to say after listening to so many experts and eminent speakers in the first half of the event, and we are kind of getting closer to the end of the day one of this very important event. Has been highlighted by all the speakers in the earlier panels why the subject is so important, particularly in India, and it comes from the apex authority of our country. Our Honorable Prime Minister every year takes cognizance of the importance of issue and addresses the state to take the necessary actions to address and protect particularly the vulnerable communities. And not just from India. I mean, we recently had a global call for action on extreme heat from the United Nations Secretary General that many of us sitting here, many organizations sitting here also contributed, including the Global Heat and Information Network. So we are talking about the governance here. You might have seen many of us governing the event today, running around, including me. So we are talking about governing the heat and cooling and strengthening the national and subnational action plans. Well, we'll definitely listen more from the experts in the panel about how the national and subnational policies and actions look like, how different sectoral approaches look like, who are the key sectors which are important in governing the extreme heat risk and providing the sustainable cooling solutions. So that we definitely are going to listen from the eminent panels. I'll not take much of your time, but in last or perhaps the first session, somebody talked about data, numbers. Samir was talking about numbers. Number can be numb. So while we should not too much be driven by the numbers, it could be sometimes disinformative and misinformative, or sometimes over-informative. But we should at least have some common understanding that who are vulnerable to heat and how can we protect them. And that's what providing a heat resilient cooling, sustainable cooling solutions mean about. I was also looking at, since this session is about governance, what does governance mean? How do we define governance? So I thought, since disaster, heat has been seen as a disaster, although it should not be. I'm reiterating it again and again that heat is not a disaster issue; it's a development issue. But when I went and looked at the definition of risk governance or disaster risk governance, that's what I found on UNDRR's prevention web page. That it is a system of institutions. A lot of institutions are sitting here. Mechanisms. Radhika very well mentioned that solutions just not need to be technological. They also have to be social. They also have to be cultural and others. So what are the mechanisms through which we are going to govern? What are the policies? What are the legal frameworks? Yesterday only or today itself, I think I read a news article saying that heat waves are just advisories. Heat action plans are just advisories, but are not very well governed. So are there enough policy, backups, legal frameworks that can support the actions on the ground? We might listen it from the eminent speakers in this session as well, and other arrangements to guide, coordinate, and oversee disaster risk reduction and related areas of policy. So that's in nutshell. We'll talk about not just national, subnational, but also international perspective in our panel that is coming up. And with this, I thank you all again for being so engaged and so patient and so such a beautiful audience and committed audience to the subject. And I hand it over to you, Anisha. Thank you.
Well, thank you so very much. That was quite an insightful exchange. Now let's refocus our attention on the stage as I welcome our esteemed panelists for a discussion on how local governments can be empowered with resources, technical support, and policy guidance need for cross-sectoral partnerships among various government departments. First and foremost, join me in welcoming and giving him a round of applause, Mr. Saurav Kumar, Vice President, India, Global Energy Alliance for People and Planet, who happens to be a moderator also. He has a distinguished career in energy policy and efficiency. A very, very warm welcome to you, sir. Up next, ladies and gentlemen, Dr. Ashley Ward, Director, Heat Policy Innovation Hub, Nicholas Institute for Energy, Environment and Sustainability, Duke University. A very warm welcome to you, ma'am. And welcome to India. Next, ladies and gentlemen, excuse me if I go wrong with the pronunciation because it's like 3-4 Indian names together. Sandra Aqua Akpene Adayemi Freitas. Is it right? Oh, I'm so glad. Thank you. CEO Sustainable Solutions for Africa. She is a prominent environmental advocate whose work has significantly impacted both her country and the African continent. A very warm welcome. Up next, ladies and gentlemen, Dr. Akash Srivastava, Additional Director, National Program on Climate Change and Human Health, National Center of Disease Control, Ministry of Health and Family Welfare, Government of India. A warm welcome to you, sir. Next, ladies and gentlemen, Mr. Gaya Prasad, Deputy Director General, Rural Housing, Ministry of Rural Development, Government of India. Someone who has done Masters of Science in Statistics. We're going to have the right kind of statistics today. A very warm welcome, sir. Up next, Dr. Sujata Sonik, Chief Secretary, Government of Maharashtra, TBC. This Sujata Sonik is an Indian Administrative Service Officer, 1987 batch, at the rank of Principal Secretary to the Government of Maharashtra and former 2017-2018 Takemi Fellow in Global Health and Population at Howard T.H. Shan School of Public Health, Harvard University. I believe she's joining us online. A very warm welcome to you, ma'am. Next, we have Mr. Aditya Valyathan Pillai, Visiting Fellow, Adaptation, and any questions for our panelists, make sure you scan the QR code which is there on your badge. It's time that I hand over the stage to Saurav Kumar, Vice President, India for Global Energy Alliance for People and Planet for this panel discussion to take this forward. Over to you, sir.
Hello. Yeah. Thank you very much. And let me first thank NRDC, particularly Dr. Deepa Bagai, for inviting me here. Let me also confess I'm no expert on heat, but I'm privileged to have a very distinguished panel who have done a lot of work internationally, in India and also nationally. And I think the kind of subject that we have is a very relevant, given that we already see very high temperatures practically all around the country. We know there have been Indian National Cooling Action Plan, there have been heat plans across the country. But the key issue that we probably learn today from this very eminent panel is as to how do we make sure that we implement those plans effectively? Because these plans need implementation not just by one ministry, department, agency, but it's a coordination that needs to be done. How do you create a body that coordinates between various stakeholders? How do you enhance capacity? Particularly, we have the Chief Secretary of Maharashtra here, and I'll be very keen to understand how do what kind of resources are needed at the state level, because that's where the action really happens. Also, we learn from what are the best practices in governance, in policies, in implementation around the world. While we reflect on the governance part, let me also remind people sitting here of something that I read a few years ago while I was still with the government, and it's a study published by the Lawrence Berkeley National Lab, and it actually is a scary study for someone like me. They said that this was a study in 2019 and 20. The air conditioner population in India, the ownership in India was less than 8%. And they predicted that if we go up to 30% by 2030, which I think we are on course, given last year we sold more than 10 million air conditioners in India, the incremental peak demand in 2030 just for cooling is 150 gigawatts. Now that is a massive, massive amount. And just to give you a context, today we stand at about 440 gigawatts. We are already talking about 1/3 of demand between now and 2030. So without wasting any further time, let me first invite my first panelist, Ashley Ward, who's the Director, Heat Policy Innovation Hub in the Nicola Institute for Energy, Environment and Sustainability, Duke University. What I'll do in the first round is that I'll request each panelist to share a couple of minutes of their thoughts on this subject. And then in the next round, what we'll do is that we'll go more deeper into conversations as to on the subject. So Ashley, over to you.
Thank you. It's an honor to be here. I really appreciate it. I want to build off of the conversation, we heard in the last panel too, and a lot of that was around multi-sector engagement. And so I'm going to talk a little bit about that, say a few things about the public sector role, and then about communities just really quickly. Engaging with the multi-sector engagement is very important for all kinds of reasons, right? And some of it we've already talked about. The private sector is in a position to innovate. Certainly public scientists and public agencies do so too, but when we think about the demand that you just described, right, we are going to be thinking about how can we partner with the private sector to help innovate those solutions that are also affordable. But also to point out that many of our workers that are exposed to heat and vulnerable to heat are actually working for private sector industry. And so helping the private sector be part of this discussion and thinking about how they can protect, not necessarily from a regulatory perspective from the public sector, but also because they want to from the private sector as well. And the private sector is really just now starting to appreciate the impact that heat is having. The World Economic Forum put out a report in December that showed that of all climate risks combined, over the next 10 years, 72% of fixed asset losses will come from extreme heat alone. That's an incredible number. And this is starting to really become a priority for those in industry who are thinking about this. So it's an opportunity, right, to engage this sector in an important new way. And they own a lot of the capital that are going to be needed to finance some of these solutions. So bringing them to the table is very important. And we can think about governance like we think about investment, right? Diversity in our approaches is also a form of resilience. So the final point I'd like to make to this is that, there are changes in governments and government priorities. And as that you all are well aware that we're undergoing that right now in the US, right? A very big shift and change in the role of the federal government. There's also changes that happen in philanthropy, every few years where they're rethinking about their strategies. When these things shift, they leave most communities vulnerable then because the resources they depended upon are no longer there. So when we talk about good governance, engaging with the private sector is smart governance. And so I'd like to just kind of think about when we think about, okay, well, how do we think about this across the public sector, right? And a lot of that has to do with evaluating some of the processes and procedures that are in place in our own agencies that make it difficult to implement the governance strategies we put in place. For example, we know that shifted work schedules protect workers, but there are many local ordinances that are noise ordinances that prevent us from industry from being able to shift their workers to work early in the morning or late at night. So one thing is those in the public agency need to think about is how do we review our policies and procedures that are currently in place and make sure that they are actually in line with the goals of our governance strategies. And then finally, on the community side, and we've talked a lot already about public perception and misperception of heat. I come from a region in the U.S. that's hot and has been hot all the time. And one of the biggest things people talk about is, oh, it's fine, we're used to this, and we're not. But that kind of misperception actually leads to a lack of urgency among our policymakers. And so how do we think about changing that public perception of risk and helping our policymakers also understand this? A lot of this has to do with the fact that communities are facing more pressing issues. When we go out into communities, they're thinking about how they're going to feed their families or how they're going to pay their rent or where they're going to live. And so it's hard to get them engaged on this topic of extreme heat. And I think that's actually the opportunity. This is the evidence that we should be providing. I'm not sure that more science around what the projections are going to move that needle. And so this is why, I think it's really important that we bring communities to the table because we get a better understanding of how we can communicate with them in ways that are practical and meaningful to them. I want to just tell a quick story, and I'll finish up about, I worked in the tobacco, when I worked in public health, and tobacco was a really big issue in our region. And even with all the evidence of how harmful tobacco was with, lung cancer and the cost that it gave to our healthcare systems and everything else, when you went to the communities and you talked to them about tobacco and the government no longer subsidizing tobacco, the first thing they would say is, tobacco built this town. And so one of the things that I have learned is, as much as I would hate, I come from a public health background, I would love for this to be the case, but health often is not the driving incentive for change. So I think that's a really important point, especially those of us who work in public health, to remember that though it is our priority, it often is not the item that drives change. And so I had a person that worked in a local government say to me one time, and I've never forgotten this phrase, never bring science and data to a fight over incentives. And that has been such a clever thing, and I have taken that into all of my work. And I really think that's something for us to think about, is making sure that we're aligning our incentives with the people that are at the table with us.
Thank you, Ashita. I think very important points that this is a multi-sectoral engagement. We need resources which are not just present but also stable, and they are rid of any policy changes that we see globally, and also appreciation from the policymakers that this is something that is. So what I'll do next is I'll go very quickly to Aditya to give his global perspective, and then I'll bring in the Chief Secretary of Maharashtra. So Aditya.
Thank you. Thanks very much. I love that quote. Never bring science to gunfight over incentives. I want to build on that a little bit and talk about the incentives for long-term action. That came up a couple of times in the earlier session. Folks talked about how there's a little bit of reactive short-term stuff going on within the system, but there isn't enough focus on the long-term, what protects people from future heat. Because heat's going to get much, much worse. So you need to put in place actions that help us protect vulnerable communities in the future. The problem is a lot of the solutions that can help create future resilience take years to mature. So you kind of have to be doing them now for it to mature in the future, right? So what we did is, and I'm just going to give you snippets of what's going on in the Indian system at the moment. We conducted the first systematic multi-city analysis of the implementation of heat actions at the ground level. So we talked to city officials, district officials, state governments, and trying to understand what was going on, what the distribution of heat actions looked like on the ground, right? So this is purely self-reported information. We picked the cities that have some of the highest heat vulnerability in the future in a 1.5 degree world with a baseline of a 1.2 degree world based on exceedance of very dangerous heat index days, right? So that's if the number of 90th percentile heat index days were exceeded by 17.5 to 20% in a 1.5 degree world. So this is relative change in the hazard. We went to those cities if they were over 1 million in population, and we asked them, what are you doing about heat, and then what are you doing about long term? This is the distribution of solutions we got. On the left, it's short-term actions, and so it's pretty heavily skewed towards the short term, right? More than 50% of the actions are short term. This is a qualified success because we weren't able to go and check whether each of these was being implemented correctly. But it's been 12 years since the first heat action plan, and it looks like the mainstreaming of short-term emergency response measures has seeped to the bottom level across all the cities and states. Right? How effective it is, we don't know, but at least the narrative has seeped in. The second bit is the long term, and here we found something we didn't expect, which is there are long-term measures, but the box we really care about is the top right, long-term intentional. That is, these are actions being implemented intentionally to deal with heat and have long-term effects, right? And you'll see things, the health system is overrepresented in that area. So staff trainings for health, death surveillance, basically monitoring deaths. These are systems that are being set up now specifically with heat in mind. There are also others such as setting up local automatic weather stations, training for implementers and so on. And towards the right-hand side, you'll see that they become less frequent. The light blue at the bottom right is where we could get the most gains very quickly. So these are actions with long-term effects, but being implemented without heat in mind. So trees are being planted for a variety of centrally sponsored schemes and so on, but they don't have heat in their core logic. So they're being planted in places that don't perfectly make sense. It's what Mr. Amit Proti was saying this morning, right? The trees, it's very hard to plant the trees in the places that actually need it the most because it's politically very difficult, because it's very dense, because it's concretized. So the trees are being planted, it's just being planted in places that are easy to plant them, right? Same for open spaces, same for rainwater harvesting, rooftop solar, all of these things that could have heat resilience benefits, we're not getting the sort of targeting efficiency we need, right? And I'm just going to very quickly run through, next slide. This is the financing landscape. This really surprised us. 69% of implementers reported adequate financing because they weren't implementing long-term actions. So the things that are being implemented right now are really cheap. And then you'll see 21% say some financing but inadequate, and 10% say no funding. We assume those are the people that are actually trying to push the boundaries and do the long-term financing. So long-term financing will require a lot more. Long-term actions will require more financing in the future. They're pooling money at the localized level from a variety of sources. So from departmental budgets, of course, but also state government funding, central government funding, Amrit, Jal Jeevan, Smart City, NPCCHH. Now, all of these came up in the opening session when the minister talked about some of them, and others also talked about these things. Private finance, corporate social responsibility is driving tree planting, but it's not heat aligned at the moment. So there are all these like tiny things that we can actually tweak and fix to make things work. And incentives. What is driving heat action? So we asked about channels of pressure that implementers face. The pressure is always on relieving short-term suffering. It's on water scarcity, it's about changing labor hours. So the pressures are going to implementers push in short-termist direction. There's very little pressure for long-term resilience. So the long-term resilience has to operate in the ether in a way because it's not getting direct political push from people. Heat deaths seem to be driving a driving force of action. But other than that, there's very little promoting long-term, so it'll have to be a technocratic response to them. I think I'll just end with this one sort of overview. This is across all our implementers in different sectors. This is the range of issues they reported. So this is basically the entire list of things that we need to solve. Just focus on the top line there. All responses. The single largest issue that surfaced from all departments in 9 states was coordination failures. The second was competing priorities. They're short staff. There are other things. There are 100 different things to do. You're not talking to me about heat, which is some emerging sci-fi agenda. What is this? And I think a lot of the people here who actually work with local governments, NRDC, CW, etc., will understand this sort of instinct, right? There's not enough time. The percentage of people who actually said they did not see heat as a problem was much less than I personally expected, right? It was about 14%. And then there's the usual staff crunch, weak technical capacity, and inadequate finance, all coming at about 11%. So I'll just stop there for an overview of what heat implementation looks like.
Thanks, Aditya. Two things that stand out is the fact that there is more reactive planning rather than a proactive planning, short term versus long term. And I think it's the right time to really slip into requesting the Chief Secretary, Dr. Sujata Sonik, on the fact that the states do have issues with regard to institutional capacity. Ma'am, your opening remarks, please.
Yes, good afternoon. I hope, good evening. I hope everyone is able to hear me. I could not come in person, although I have interest in attending such conferences. It's a great idea to listen to each other's perspectives and also share what we seem to try and do as part of the government. So, thank you so much, NRDC, for inviting me to be here. And a little bit about my own self and my work in heat. So, it's been almost now a decade that I have been working on heat, and it started when I was posted as the Public Health Secretary of Maharashtra. I realized that almost 15 districts in the state suffered from extreme heat during the summer season, and then the cases were coming to our public health facilities, and there was no standardized SOP or system to treat, and usually any mortality thereof was never listed as that. It was always shown as a comorbidity fatality. And in those days, I also happened to attend a NRDC-led a conference in Gandhinagar with IIPH Gandhinagar, in which there was this push for getting the Ahmedabad Heat Action Plan ready. And for me, it was an eye-opener. I came back and I did the Heat Action Plan for 7 districts in Maharashtra, the first one being in Nagpur in 2015-16. So NRDC has actually been a part of this journey. So that's why I could hardly have missed being part of today's panel. Moving forward, as to what is it that governments and typically state governments do, let me also tell you that this year, in this summer, in February, we've seen the first ever extreme heat already in Mumbai. Temperature soared up to 40 degrees, and this lasted for a couple of days. And it was very sudden, the change in the weather. And what it shows is that even at night, the temperatures hover around 30 degrees. So there's no respite in the evening. So in this background, what I would like to share with you is what is it that the state government is doing. So we have all the basically heat action plans in place for the cities of Mumbai and Pune, as well as in Thane being now almost the extended part of the greater suburban Mumbai. So Thane also has a very detailed heat action plan. And then, as I mentioned earlier, Nagpur was the first heat action plan we made way back in 2015-16, and it continues to be operational. So although we commit ourselves to an agenda of ensuring that we meet the targets that are set for us by Government of India, and we consult with the NDMA from time to time, what has been my own understanding and experience working in this is that, come summer and we start talking about heat action plans and what is happening on the ground, and the moment the first rainfall happens, all of those things disappear into the background to come forward again in the next month. So although we have things like these heat action plans, they are not really tailored to the requirements of a local level. Now we have large metropolis areas in Maharashtra. It's rapidly urbanizing state, and although we have these plans, they do not address the needs at the local level. So what do I mean by that? So if you look at a ward, it doesn't necessarily, put forward a list of activities that can be taken up by the city or municipal administration much in advance of the heat actually happening. So the work has to start at least 6 months prior, which is at the end of the monsoon season, the prior year. But what happens typically is that for a few months there is some sort of a slowdown and not enough attention is paid to what can happen or what needs to happen. And then on the other hand, you find that technical institutes continue to do their exercises, they are gathering information, they are doing some pilot projects, they are working in the slum and other not very legal kind of areas, and they are trying to get some information on what the heat impact is on both livelihood and health. So looking at this, the first thing that comes to my mind is by now, India, in fact, and in also all the states where we do have high heat in summer, should have already developed a very strong and robust system of dealing with it. We should have already a center for excellence. We should have had gathered a lot of data and studied it to come out with both short, medium, and long-term solutions, and not be looking at a plan and then working towards it. So while consultants lend a lot of value in bringing forward the best global practices from across the world, what needs to happen is the key actors at the local level need to be involved, because they are the ones who know what goes on at what time and how they can probably do with a little bit of support and change. So real-time data collection and monitoring and analysis of this data can really help us. With the advent of new technologies, we must really look at how we can gather those data. So when I was working, for example, in 3 cities in the last 6 months, we found that there were many data gaps. So the plans are typically very broad-based. They do not address the finer nuances of a particular area, and therefore the capacity at the local level to also interpret what's happening is also very low. So that needs to change moving forward. So I would say that integrating ward and regional plans with the development plans and ensuring that there is better data collection needs to happen. We need to have a better multi-layered approach for combining infrastructure, climate, and resilience strategies, which is very essential in my view. Most of the time we are reactive, we're not really responsive, and that needs to change. And of course, technology can be harnessed to look at the data of the last 2-3 years and see the trends and see where the worst impacts have come during the last summer or the last 3 summers, and then prepare for it well in advance, and ensuring that the most vulnerable are the ones we are prioritizing for giving support. Indeed, it is done, but I am saying that it needs to be done in a better, more organized and a sort of more coordinated way. So therefore, I feel that both the NDMA and the SDMA in the different states need to be more thorough in what is it that they can do in the run-up to any summer season, and ensure that heat waves are treated not as just a one-off situation and we just wait for the media to tell us that we are in the middle of the next one, but they have to be treated as recurring disasters, which has an impact both on your economy as well as on your public health system. And they need to be institutionalized in such a way that the fact that it's a recurring disaster, there should be some SOPs in place which can take care of an occurrence when it actually happens in real time, and not really wait to receive instructions from usually the state government to be able to deal with it better. So to conclude, a stronger data, a clear accountability, a better understanding of what has happened in the past, what is it, which particular area needs more attention in comparison to others, and what are the best practices that some of the local officials rolled out which have given results, is what it should take to fix a heat wave in the short term as well as in the medium term. I'll stop here because I'm mindful of the fact that this is a big panel and there are many people, many more panelists waiting to speak. Thank you so much once again for the opportunity.
Thank you.
Back to you,
Dr. Sonik. I think very clear words. We need data, we need enhanced capacity, we need a proactive planning, we need best practices as to what worked well in India in a particular city and so on. So let me now turn my attention toward the new continent, and Sandra, let me bring you in for your opening remarks.
Thanks very much. I would like to frame my opening remark around the need for climate change to remain top priority in the global agenda, international agenda. It's very important that commitment for climate change and strengthening governance remain the top priority despite the geopolitical dynamics we are seeing. It's my very first time to be in a meeting on heat and sustainable cooling. And I was asking myself, why? How is it like? It's my first time to be in a meeting like that and have to travel all the way to India to be able to participate in a meeting. And of course, I'm impressed to see a decade of leadership around the topic. Such an important topic. In the previous sessions, we heard that demand for coolings are coming from many countries, top 10 of them coming from Africa. Yet, most of our climate change framework, while recognizing that temperature rising and heats, it's a severe stressor, are yet to take specific actions on these topics. Very few countries are addressing the topics. So instead of losing momentum, we need strong leadership, even from individual countries, on specific topics. Strengthening the overall governance, but also strengthening governance around specific topics like this. What is happening here must inform policies in Africa. It's so needed, it's so important, and we will, back home, back in the continent, raise more the awareness around this topic. Just to say, it's so important that all countries keep climate change as a top priority and issue related to heat and sustainable cooling as one of the priorities.
Thank you, Sandra. I think, yes, absolutely. I think you couldn't say this better. Climate change has to be the top priority, and it will. Let me turn to Mr. Akash Srivastava for your opening remarks.
So, my area is health, and in context of heat and health, frankly speaking, for the health sector, it's one of the new domains that the health sector has to be addressing in the last couple of years. Broadly, people from medical sector are being used to addressing infectious diseases, non-communicable diseases, but such environmental concerns have usually not been the sphere in which so much the medical professionals have been involved largely in this country for a long time. And when looking at the work that the gentleman showed about how different sectors have responded to the question, including even health sector professionals, a lot of them saying they do not consider heat as a problem. It's quite possible it's not what they understand on their routine work, but nevertheless, based on the statistics that we've heard since morning and elsewhere, talking about heat and talking about climate change, health sector, the health is probably one of the areas in which you're going to have the most of the impact. But when I say health, I also want to say the words that the health sector is itself a very weak sector. It's usually, it finds very difficult to address the existing health burden in the countries. Countries like India has a public health sector that responds to the large base of population across India, a lot of its rural population. In that context, it becomes very difficult for seeking the health sector to address this problem on its own when you have a new problem as you said coming up. We had in the previous panel speakers talking about how important in health is infrastructure, and that infrastructure also applies to health infrastructure. The health infrastructure really requires a lot of investment as such, and when you speak of climate change and you speak of heat and you need all those changes to be done to ensure that your health infrastructure is resilient to those impacts, it means huge investment. And for that, we need resources, we need support of all sectors who work in these areas, those who work in renewable energy, those who work in water, those who work in rural development, those who work in fire, all of those sectors to come forward and also pay attention to what's the situation with the health sector, because health sector is where you need to pay attention. Time will come when you will not have succeeded much in stopping the heat from coming, and a lot of your sick people, a lot of your old people will eventually end up in these hospitals, in these healthcare institutions. And if you do not invest in these healthcare institutions and you leave the existing health sector to handle on its own for that fairness, that would be unfair. You need to also prepare that while you are investing elsewhere, you also need to ensure that your health institutions are prepared to bear the brunt of what's coming forth for it. We're working in a national program on climate change and human health in the last 5 years in this country, working towards this issue. And even though we've been doing a lot of work, but we still think that while we in the health sector spend a lot of investment in strengthening our sectors, other sectors, and people who work in the area of climate change and the area of heat do not dedicate equal amount of investment of their time and resources to the health infrastructure, to the health building of capacities of the health institutions and health workforce. And with that, I will give my opinion.
Thank you. I think you emphasize the importance of the institutional framework both at the state, city level. And with this, let me turn to Shri Jaya Prasad from the Ministry of Rural Development, Government of India. Your opening remarks, please.
Thank you, sir. Now, because since inaugural session, we were discussing on the heat and its related issues. Actually, I am in the ministry and looking after the rural housing scheme in the country. I would like to just highlight what is the basic feature of our scheme, because we are actually involved in the construction of houses in India, rural India. And we in the last 7-8 years, when this government came in power, it was decided that let us have some focused method of going for the construction of rural houses in the country. And in the last 7-8 years, we have constructed more than 35 million houses in rural India. One thing, because why we have realized what are the initiatives to be taken. I would like to quote Professor Radhika Khoshla, because we have taken so many initiatives under our scheme to go for implementation of the scheme and use the technology in a big way. That is the main achievement of the scheme, that is called rural housing. But now, the important other aspects of the rural housing, whether the house is actually meeting the quality aspects, different quality aspects of the house, or whether we are actually addressing the heat issues in implementation of just I would like to come here. I want to see next slide. I will take I will try to complete 7-8 minutes only. But if I exceed 1 more minute, so I will just be there to be allowed.
If you can be slightly briefer than 7-8 minutes, it will be nice, because if you can complete this in about 4 minutes, it will be nice.
Yeah. So actually, I would like to just apprise the August here, just for the information, because this government, the government of India, we have constructed good number of houses in the last 8-9 years. If you see the outside, around 37 million houses that we allocated to the country. So far, we have constructed more than 27 million houses in the last year, and if we include the other houses. So, and the government is, and also we are going to construct 20 million more houses in next 5 years. So, this is the commitment. This is the commitment of the government. And if you see, we are investing huge money in construction of the houses. That we are targeting 20 million more houses. If you see, more than $35.42 billion this government is investing in construction of the houses. We are providing the cost, this financial assistance to the beneficiaries, because in rural houses the challenges is, one way it is strength of the scheme, the other way it's a challenges also, because here the beneficiaries are constructing the houses. We don't have any contractor or any agency for construction of the houses and we are providing financial assistance to the beneficiaries directly into the account of the beneficiary, and it is linked to the stage of construction of the houses. In this way, the beneficiaries are constructing the houses. And one issue, because we have realized our role is not to only go for construction of the houses. The house has become the platform to converge with many schemes. We are ensuring that the beneficiary should get the benefit of solar gas connection, then also solar rooftop, also converge with the Jal Jeevan Mission to get the water connection and other basic amenities, so that a house will become in a Pakka house in true sense with all basic amenities. I think this is not working. So technology in the government of India, we have many schemes implementing in the country, and PMAYG is the one scheme who is the number one if you see this use of the IT solutions. But here IT is not the solution for addressing the heat issues in this. So one way, because our role is to orient the beneficiaries, whether we have once when this scheme was launched by the Honorable Prime Minister in 2016, at that time we prepared the house design typology for the beneficiary, keeping in view the cultural consideration, locally available materials, and also the other aspects of that region. And Central Building Research Institute, IIT Delhi, and other institutes, UNDP, they assisted us in finalizing the design of the scheme. Now we have moved to because we have our everything technology-based platform, so we are ensuring that the beneficiary has to select the design, even at the time of the sanctioning of the houses to them. So the 3D designs are also made available to the beneficiaries for construction of the houses. So one issue is this is now the point. So far we have highlighted, I have presented what are the challenge features, how we are ensuring. But now the challenge is that whether the climate challenges, what are the impact of this, and how the PMAYG is going to actually, what are the challenges in implementation of this scheme. So our point is that is why we approached you, and this another 20 million houses announced. Then we had the detailed discussion in September 2024 with the World Bank team and other institutes to let us go for some innovative thinking and solutions. What are the solutions that are available to actually going to address these aspects of the house? There are some active measures, there are some passive measures also to address this issue. So in this way, we have discussed since beginning. I have already mentioned that we had the house design typology, we have other aspects also, but the problem is how we are, because the number, if you see 20 million houses, and we have all these details, panchayat wise, village wise, that who is the beneficiary, whether the house is pakka, what are the other aspects. So in this way, but the challenges is that how this aspects is actually going to ensure whether these houses are actually meeting the basic features of the to address the challenges also. So that's all from my side. I would like to lastly request the August gathering here to give us solution, give us the ideas, give us the ways how to address this aspect in implementation of the PMAYC, and this government is actually committed to go for construction of good houses with meeting the all required measures. Thank you very much.
Thank you, sir. Thank you for speaking. Let me turn to my last, but certainly not the least, Dr. Shah, who is the nodal officer for Ahmedabad Action Plan. Your remarks, please.
So we are implementing heat action plan since last 12 years, and I will not take long time. But when we have started this heat action plan, I don't remember that any of the citizens were getting any kind of alerts across the city, red alert, orange alert, or yellow alert. So we were the first ones who had started all this. So frankly speaking, it is very difficult to convince all the multi-sectoral involvement is very important, and political commitment is very important. But looking at this quorum and all the panelists, so our efforts are very minimal, I can say. We are implementing heat action plans in some of the cities, and we are happy that we have started heat action plans. But in Gujarat only, there are 159 municipalities, 17 municipal corporations, and 142 small municipalities. So the problem is huge, and we are talking about small pieces working here and there. And the task is huge. Actually, municipalities and in Gujarat, the urbanization is up to the extent of 48%. So more, the next year's budget is also Gujarat government budget is urban budget, and urban it is more focused on urban areas, and urban areas do have their own problems. And to make the administrators and the politicians convinced that heat is really a problem, we are able to run this heat action plan because we were very fortunate that Indian Institute of Public Health, Gandhinagar, was supporting us as technical partner, but everybody else is not that fortunate. So to implement on a city, nationwide scale, technical assistance is most important, and the data is also most important. The thing is that we do have very good birth and death registration system in our city. So after what are the impacts of heat action plan? Now we can correlate with data as well. We do have 3 hottest years during last 15 years, 2010, 2016 and 2024. The mortality in the month of May, when the consecutive heat alert days were high, was about 40% higher than the average deaths in the 2010 year. While with the same number of heat alert days in 2024, I can proudly say the mortality was only 7% higher than the usual average monthly data. And when I show this data to administrators, politicians, I am able to convince them. Our own 2025 budget, municipal corporation budget, Ahmedabad municipal corporation budget amounts to around 15,000 CR, and we had named it climate budget for this year. And each and every department, earlier health department was the only department who was preparing their heat action plan. Now all the stakeholders, whether it is a state department, engineering department, school board department, ICDS department, the child development services, all the departments make their own heat action plans, and they do work in whatever way they do to mitigate the effects of extreme heat. So this kind of actions are required, and everybody needs to own. Not a single department can't work on their own. All the departments must have their own roles. Even our publicity department, we do have our own publicity department to reach each and every corner of the society. But certain things which we want to have is uh, every big city must have some consultant. Engineering department and other department do have consultants, but for heat related illnesses we do need technical support for continuous guidance. And madam has rightly said that it is not work of a period for 3 months or 4 months. A continuous work is required. Data analysis. Uh, Even when I talk about myself, I am Registrar of Birth and Death and Marriage for the City of Ahmedabad, which caters around 1 CR population. I am City Tuberculosis Officer, and this is an ad hoc charge of officer which I am holding. So we do need technical guidance, we do need consultants. The other thing is that there are no policies for the most vulnerable ones. We can say we are talking about construction site workers, we are talking about industrial laborers, but we don't have any policy. There is no document available. Those who are employing these workers, such as builders, industrialists, even if they want to adopt any policy, there is no document available. What they need to do, we just talk about keep ORS available, keep water available, don't allow them to work between 12 to 4, but there are no mandatory rules. So certain NDMA can help us in providing, it should be mandatory for each and every, the policy is that the municipalities or administrators needs to do this and follow this. If somebody is not following this, penalize them, do whatever you want to do. So at national level, we need some policy. We are there to implement such policies, but the guidelines can come from the national level. So each and every state at every corner of the society can implement.
Thank you. Clear guidance from the center and DMA is what is needed. So we have a little over 20 minutes left and we have 7 panelists. So what I intend to do is to go around the table with a specific question or a comment that the panelists want to make. I'll start with the practitioners first, and then Ashley, I'll come to you and Aditya in the end to possibly sum it up for the benefit of all of us. So let me start with the Chief Secretary, Maharashtra. Ma'am, you've heard everyone here, and you also heard you talk about what are the 2-3 things that you would recommend to the audience here and the panelists, which is a takeaway as they design the next set of heat action plans for their implementation.
Thank you so much. I would like to say that it's important that, as the the preceding speaker mentioned, there has to be continuous work on this. This is not something that you do for a couple of months and then you forget about it. This needs continuous work, and this can also be pegged to the kind of releases that come for funds from the central government. It could be pegged to a couple of deliverables that a state that has completed, say, on a scale of 1 to 10, the first 2 or 3 steps, then is incentivized by releasing extra funding, as it happened earlier in the national health issue. Because this is not just about climate and it's not just about management of heat, but it is also a public health issue. And I don't think the seriousness of actually looking at it from the public health lens has sort of percolated everywhere. The second thing I want to say is that the technical agencies that work on this with the state government, they all report to the science and technology vertical. So they are not usually available to sort of partner any local initiative at the district level or even at the municipal level, and because of the the way the things are. So we need to break down these silos and ensure that the technical agencies who have all the data and who have the means to guide the local authorities as to what they should do, where they should spend the money for what particular kind of a mitigation measure that can help, they must work together with us, and that doesn't often happen. It sometimes is based on the local people they can cooperate, but not everyone does it across the board. And the last thing I would like to say is that it's very, very important that we have data points that can get us information of what's happening in a particular ward and prioritize our funding according to the requirement in those areas. It cannot be just spreading a little bit of money everywhere. So the SPMs need to be strengthened more to be able to do that. Thank you.
Thank you, ma'am. I think you're re-emphasizing the need for it. And I also see a few questions from the audience related to it. I will come to later. Let me turn to you, Sandra. And Sandra, you've been working on this for a while now. Has any global partnerships helped African government access technology, expertise, and resources to implement heat resilient solutions that you can talk about it?
Public partnership will necessarily be important, relevant because of the scale of the issue. So you will need public intervention to set the policy directions that we have seen in India here. You will need it also to provide clarity on the mandate, clarity on the responsibility. Somebody needs to be assigned the responsibility. You need to have clear KPIs to be able to monitor the necessary adequate indicators and provide a monitoring framework that you need to be able to follow the implementation of the measures. In addition to that, there is a strong role for the public sector to provide the necessary environment to enable innovations and private sector actors using blended finance to be able to develop solutions that are scalable and have to be scaled, but more important, that are affordable. Because as we discussed it, those that need it the most are really vulnerable, and the issue of affordability will be very critical. And the last issue will be around efficiency, because as we discussed, this dynamic between heat and cooling, you don't want to promote the solutions that will create a vicious circle to aggravate the problem. Then issue around efficiency, issue around standards to be able to make sure that the solutions that proposed are sustainable and contribute really to the solutions at scale will be very important. That's why you will see a vital role for public sector alongside with other actors, private sector, civil society, for an effective solution. And we can see this as part of support cooperations to support countries in Africa, learning from what India has been doing.
Thank you. Before I go to the next panelist, I encourage the audience to please send us more questions that we could possibly take up, if not necessarily in the panel, but maybe later on. Let me turn to Dr. Srivastav. One of the things that the government of India has been doing is how can you scale up and propagate successful models? We heard from Ahmedabad, we also heard from Maharashtra Chief Secretary as well. What can the governments do to scale up the best practices that we see in cities and that becomes institutionalized at the central, at the state level? Dr. Srivastav.
So, we in our this program called now the National Program on Climate Change and Human Health. To start with, we work with the different states to help them to develop their heat health plans. On date, all these states today have eventually completed their heat health plans. You could log in to NCDC website and have a look at those heat health plans. They're all on the website. The next question, of course, we realize the challenge that a question like heat would probably require to go below the state level, maybe to a district level or a city level, as we saw about challenges in states of Maharashtra. So we today are working on the district level action plans of heat and health, and over 100 of districts are today in drafting stage of their heat health action plan. The reason why we're working with districts is because the way the health sector is designed, we have an administrative arrangement to work with the district level its offices, and it helps us for us to develop district level heat health action plans. We realized that we would also eventually someday need to have a city level heat health action plan, but they are cities are mostly municipalities and municipal corporations, and they are independent local governments, and their health sectors do not correspond to how we have an administrative arrangement with the states or the district. So that would probably be a slightly difficult and challenging task for us, but we do realize, considering the heat island effects that we have in every city, that's one big challenge. But irrespective of what the challenge is, the major concerns is all to have an intersectoral play, an arrangement in which there is a partnership with other sectors who have an important role to play. And in this context, in all our arrangements that we made, whether at the state level or at the district level, we have put in forth a task force, one at the state level and one at the district level. The state task force is being chaired by the Principal Secretary of Health, and the district task force is chaired by district magistrates. This task force is essentially meant for health issues of heat and climate change purposes. This is where the health leaves the agenda and puts into forefront the concerns it has in relation to how climate change or heat impacts the health. And then based on that agenda, there is coordination and contributory role of other sectors to it. So that's how it works to provide an intersectoral exchange of work. And also, as I said, also for them to contribute in terms of resources that they may have in place so that there is a more effective action plan in place.
Thank you. Thank you. Let me turn to Mr. Gaya Prasad very quickly here, under 10 minutes now. You talked about active and passive things that you have put in the rural housing. One of the most important things is how do you make the communities resilient? So is there any plans that the Ministry of Rural Development working in? I know you've heard about urban plans, but it's an equally compelling issue in the rural areas as well. So is there any thought that the ministry has on engaging with the community, making them resilient to the rural areas?
Sir, even the main task for one way we are orienting the beneficiaries and also informing their rights and role in implementation of the scheme. The other way we are also, because there are 3-4 activities that we are taking, because we have a system in the ministry. When we are going to allocate the target to the state, then we also consider what are the actions to be taken by the states and districts while implementing this scheme. One way we are also we have a very good system of training rural youth, training rural missions, actually to ensure the quality of the houses. One way we have a very good system. Suppose if anything happens under the scheme, we have using the technology in a big way to inform them, to orient them to like this. At present, we are conducting the survey to identify for eligible rural households to extend the benefit of the scheme in next 5 years. So we have our IT solutions, we have our mobile app system which was launched by the Honorable Prime Minister, and now every household we have now empowered the household to use the app and register their name in using that app. So in this way we have very good system IC activity in the ministry, and then informing to the beneficiaries and households also to get the benefits. So this is the way that one way this is a government system issuing advisory etc., and the other way we are also approaching to be orienting the beneficiaries, because this scheme is purely led by the beneficiary. Beneficiary is the face, beneficiary is the implementer, beneficiary is the getting the benefit. Our role is to ensure that they should get the funds timely at the time of the construction of the houses, and then ensure for completion of the houses.
Thank you. I think integration of IT, very clear guidance are important. Let me turn to you, Dr. Shah. Can you very quickly, maybe in a minute, talk about how did you get the community into this whole picture as you created the plans and implemented them?
Hello. Community involvement is very important. So there are various departments across government sectors, such as in municipal corporation area. We do have this integrated child development service department. Then UCD, urban community development department, health department, where the people are there who are working in slum and slum-like areas where the most vulnerable people live. Even in municipal schools, in Ahmedabad city, 2.1 lakh children are studying in municipal school, and they do come from the most vulnerable ones. So sensitization of this, all these grassroots level workers such as Anganwadi workers, Asha workers, and under UCD department, area level federations are there who do have very strong hold in the most vulnerable people's group. And the other thing is that trying to demonstrate the effects of the impact of such as school roofing solutions is there. In Ahmedabad, the global multicentric project is ongoing for cool roofing. There is no study actually right now the impact of cool roofing on health parameters of individuals. So a global study is ongoing, and we are going to demonstrate the effects of cool roofing on health parameters, the baseline indicator, and it is a very good study. Within a year or so, we will come up with
Dr. Shah, sorry, I wanted you to be very specific on the community involvement, not on the cool roof.
By demonstrating the results, the community will get involved. So in this way, we can involve.
Okay, thank you. Now, you've heard the practitioners, both at the center, state government, municipal level, city level. Let me turn to Ashley and then to Aditya. What are your take on what you've just heard, and what could be your two key recommendations for the people sitting on the panel and in the room here?
I think, so this kind of goes to one of the questions is what role can the public play in implementing the heat action plan? So one thing I think is to recognize that a heat action plan is one tool in the toolbox of heat governance. This came up in the last panel. Governance includes policies and procedures, as early warning systems, and the structures in which all of it operates. And so to what I've just heard, on the panel 2 and the panel earlier, it's also a recognition that when we think about sort of heat health, we're thinking about maybe well-being, which includes economic and social well-being and all the structures that support that. And so I think stepping back and kind of expanding our view on that is really important. And so when we say what specifically could the public do, or this question is, and you kind of asked that question just a moment ago, to give you some specific examples, I think would, to help think about this differently is integrating actions into programs that already exist. For example, there's a program in the U.S. called Meals on Wheels, where people deliver meals to aged individuals. Helping those volunteers know to ask questions about, is your air conditioning working, or how are you feeling today? Pass on information. Today's a high heat warning day. Those kinds of things can be integrated at every level into heat governance. They can pass on information about, here's how you do foot or arm immersion to cool your core body temperature. These kinds of flyers can go out. First responders in any case and any disaster and anything are your neighbors. I mean, that's who's with you first. So whenever anything happens, you look at the person beside you, because that's probably going to be the person that's going to help you whenever it gets really bad. So thinking about how we can support neighborhood groups, right? And ensuring that at the neighborhood and local level, at the village level, people know who it is that are needing assistance. There's a volunteer fire department system in the U.S. They're wonderful at knowing. They know who can't afford to run their air conditioner, and it's wonderful. It's a wonderful network. But schools, to your point just a moment ago, are an excellent way. Children bring home information to their parents, and their parents listen to them. And so thinking about how you can integrate information from the school to the household, really important. There is a really low-tech solution in the community that I worked in, and everybody thinks about all these digital solutions and all these things, early warning with messaging and all this. You know what they did? They stuck a flag at their school. That's what they did. So every morning when the forecast was going to be bad, they had rain. So every parent who dropped off kids or anything could see that today was going to be a bad day. And it worked. Parents started talking about it. People started referring to it. Oh, it's going to be this today. So I think, as we start to expand our thinking about who are the actors at the table and who are those that can actually help us effectively implement and carry out heat governance, I think we need to think of it as an everybody. It is an all of us together response. There isn't one sector that owns this, and in fact, it is the collective effort of it's all that's going to be the most effective.
Thank you, Aishna. And while you respond, Aditya, there's also a specific question listed for you. Maybe you can also take it up.
Yeah, thank you. I'll start with trying to summarize and respond in some policy recommendations. I think it's extremely important to focus on what Mr. Shah said about the legal mandate for the heat action plan. Right? So these are guidance documents at the moment. They don't have deep legal. We heard earlier about cooling being a right. We talked about implementation of heat action plans, but within the current sort of bureaucratic system, it needs to have some heft, it needs to have some weight. And how to do this, I think, will vary state by state. I think it's possible to do an omnibus legislation for all climate impacts at the state level. It's possible to do heat-specific legislation. It's possible to sub-legislate under disaster management. There's a variety of solutions. But for the local bureaucrat who's seriously short-staffed, max capacity, there has to be some reason this surfaces to the top. Otherwise, we end up in seasonal cycles where you lurch from one disaster to the next, like Ms. Sonic was saying. Coming to the specific problem of capacity, also, I mean, you were saying you're in charge of tuberculosis and heat, which is such an interesting example because tuberculosis is something we think we've dealt with. It's a problem from the last century. Here's a problem from the new century, but it's the same person dealing with both problems. You really need to expand capacity, add more people. And if you give them training, you can solve a lot of those coordination problems because people who actually know what they're doing and care about what they're doing are likely to talk to and interact with and cooperate with other people who share the same values, right? And so that's how you solve that coordination problem. What you were saying about intersectoral task forces and so on, I think there's a base level of capacity that's required. And the third point is about the health system sort of having to absorb all of the impacts, right? It's one sector sort of taking wave after wave, not just from heat, but from multiple impacts, like Roxy was saying earlier. There is a question about what we do to deal with it. It has to be multi-sectoral, there's no doubt about it. It has to be long-term, there's no doubt about it. I think we also need to get ahead of the cooling problem and need to have policies that address cooling, which could take some of the pressure off long-term multi-sectoral action. But the cooling wave is coming. People are going to buy the air conditioners. The question is whether you get them to buy the right air conditioners. And government policy on that front is needed, right? Incentivizing the most energy efficient air conditioners at taxpayer money, channeled through the vulnerability assessment of a HAP. So that subsidy can only be accessed in specific areas. The hottest areas of the neighborhood is probably an efficient way of drawing down long-term demand for energy and making sure the most vulnerable don't die in the process. And I just want to end with one sort of very broad sort of comment about civil society partnerships. The places we went to, wherever there was a civil society partner, about your point, Sandra, about global alliances and so on, they tended to be doing much, much better. Do you want me to address that, or should I?
I think,
okay.
Let me ask, I think the time is really up. I think the panelists have answered several questions that were listed out in their own way, not necessarily very specifically. So, before I start my 45-minute concluding remarks, I hope that's fine with everyone. Let me thank my wonderful panelists sitting here at Bharat Mandapam, and also the Chief Secretary of Maharashtra for an excellent session here. I, for one, really learned a lot from hearing from each and every one of you. And can I request all of you to please give a very liberal round of applause to this wonderful panel. Thank you very much.
Thank you so much, Chair, for having me also on this panel. Thank you.